Adrenal Insufficiency. Real Stories, Real People. Presented by the My Story With Addison's support group. www.mswad.info and on Facebook. Functions of adrenal gland. The adrenal glands, of which there are two, sit atop the kidneys. They are no bigger than a walnut and weigh less than a grape. They are powerful glands which produce more than 50 hormones, including steroids such as cortisol and aldosterone. These two hormones are essential and absolutely necessary to sustain life. The hormones produced by the adrenal gland significantly affect the functioning of every single tissue, organ, and gland in the body. Your metabolism, the fluids and electrolytes in your body, every electrical impulse that keeps your heart functioning, your blood pressure, and many more physiological functions are controlled by adrenal hormones. The adrenal glands regulate other bodily functions. Carbohydrates and fats, sugar regulation, and cardiovascular and gastrointestinal function are regulated by these important glands. Without cortisol, death occurs within 72 hours. And with an imbalance of cortisol and aldosterone, your well-being and quality of health, as well as quality of life, is severely compromised. In Chinese medical terms, the adrenal gland is called the gate of life fire. Without the fire, the other functions of organ and body tissue cannot be lit up. This is one belief as to why people with adrenal insufficiency are suffering difficulties.
Hi, my name is Malisha, and I live in Wolf City, Texas. I have suffered with chronic fatigue most of my life. In high school, I would think all day about how I would sleep after school. When I would get home, sure enough, I could go to bed around 6 p.m. and sleep until I had to get up for school the next day. I did manage to participate in athletics in high school, but was always fighting fatigue and exhaustion. I was diagnosed with Addison's disease on February 25, 2012. My blood cortisol level came back at 0, and my ACTH was also high. However, because my primary adrenal failure was caught early, I didn't get the dark tan like most primary adrenal patients. However, I do have freckles that look like small blood droplets all over my body. On April 1, 2015, I was diagnosed with Hashimoto's disease, or autoimmune thyroid disease. My TSH levels kept coming back normal, but a low T4 level. Finally, after seeing an endocrinologist, she tested my thyroid antibodies, and sure enough, my thyroid peroxidase antibody was extremely high. Addison's and Hashimoto's sometimes go hand in hand. Many patients have both diseases. A few of my other diagnoses are fibromyalgia and recurrent calcium phosphate kidney stones. I have undergone 10 lithotripsies since the year 2002 for recurring stones. I currently have 4 submucosal kidney stones around 4 millimeters each. I am not sure about getting this surgery since my kidney has to be opened with a laser for the procedure. The stress it will cause with my Addison's disease will be high risk. So I think I will postpone this until it becomes urgent. Even with 25 milligrams of Cortef each day and 25 milligrams of Armour, I still feel fatigued and can lie in bed for days without any social interaction. The body pain I experience is extreme, and I have to take 6 tramadol each day just to be comfortable. Insomnia is also a big problem for me, so I can never experience refreshing sleep. The general educational material posted is so outdated about this illness. I would love more awareness for all of us fighting adrenal insufficiency. My family is my strength. My husband, Andy, and my 2 girls, Victoria and Hope. They keep me going.
Forms and causes of adrenal insufficiency. The most common forms of adrenal insufficiency are known as Addison's disease and congenital adrenal hyperplasia, CAH, although there are other causes. While patients with CAH are born with the illness, Addison's patients develop the incurable illness at any time later in life through at least 60 different circumstances, which include, among others, AIDS, following the cure of Cushing's syndrome, fungal infections, hemorrhage, hypothalamic tumors, inflammation of the adrenal gland, multiple sclerosis, panhypopituitarism, Prader-Willi syndrome, polyendocrine deficiency, Sheehan's syndrome, spinal cord injuries, systemic amyloidosis, use of long-term steroids, adrenoleukodystrophy, ALD, cancer, pituitary tumor, asthma, autoimmune disorders, arthritis, acquired ACTH deficiency, bilateral adrenalectomy, unknown cause. There are two forms of Addison's disease, primary and secondary. Primary involves issues with the adrenal gland itself, while secondary involves issues with the pituitary gland. Congenital adrenal hyperplasia, congenital meaning it is present at birth, comes in several forms. One is obvious at birth by physical signs and most often an adrenal crisis within days of birth. Other forms are considered late onset, usually becoming medical emergencies during late adolescence that, in the past, led to diagnosis. Today, most states require newborn screening for CAH. CAH is caused by enzyme deficiencies, the most common being 21-hydroxylase. This is a cytochrome P450 enzyme that is involved with the biosynthesis of the steroid hormones aldosterone and cortisol. Both Addison's disease and congenital adrenal hyperplasia have two forms, salt wasting and non-salt wasting. Salt wasting forms have deficiencies of the hormone aldosterone, which regulate the balance of salt and water in the body, necessary for life, as well as deficiencies of the hormone cortisol, also necessary for life. Cortisol affects many different body systems, including bone growth, blood pressure control, immune system function, metabolism of fats, carbohydrates and protein, nervous system function, and stress response. Non-salt wasting forms of adrenal insufficiency involve deficiencies of the hormone cortisol and not aldosterone. Although the adrenal glands produce more than 50 hormones, cortisol and aldosterone are the most physiologically active. The lack of either aldosterone or cortisol can lead to a crisis, which is life-threatening, and if proper intervention is not practiced in an extremely timely manner, shock, followed by coma, is imminent, with death following if no intervention is made.
My name is Lisa, and I have late-onset congenital adrenal hyperplasia as my form of adrenal insufficiency, as well as mitral valve prolapse and regurgitation, and before my hysterectomy, I had polycystic ovarian syndrome and menorrhagia. I also struggle with hypoglycemia, hyponatremia, bradycardia, gastroesophageal reflux disease, chronic bronchitis, low vitamin D, and numerous recurring symptoms such as vomiting and diarrhea, extremely low blood pressure and fainting, easy bruising, slow wound healing, etc. I previously had fertility problems, and upon receiving treatment to help ovulate and become pregnant, I had a very high-risk pregnancy and delivery with numerous problems. I was diagnosed in 1985 with my CAH after years of constant illness and unexplainable symptoms. Adrenal insufficiency has changed my life by limiting my activities due to the possibility of becoming dehydrated and fainting and going into shock. So I'm not able to do much outdoors in the heat and humidity or even walking in large stores. I cannot work at my career in the manner I should, as it requires lots of traveling and outside field work. I've had to limit my involvement in my career and am fortunate to be able to work from home. My daily life is different each and every day. I don't know if I will have heart issues and will not be able to leave the house, or I might faint and have to have an emergency injection and go to the ER due to dehydration and low blood pressure. My family is affected because they are so worried about me being alone with nobody to give me my shot or call an ambulance or even going to dinner because I have literally fainted in my plate before. In the past, I took daily steroids in the form of dexamethasone but developed Cushing's syndrome after years of too high a dose, and I took fludrocortisone because I cannot balance salt and water due to almost non-existent hormone aldosterone. I also have had to take blood pressure meds due to high doses of steroids, heart meds, digestion and stomach meds, but today I'm treated with homeopathic medications, but do take hydrocortisone when needing a stress dose, and have an emergency injection of dexamethasone if I am sick for more than 2 days, am injured, or faint. My quality of life has only been good in sporadic, random times in the last 30 years, and I'm not able to continue obtaining my dreams. I miss the me I was able to be in certain healthy-feeling times of my life, and dread returning to the cyclic, very ill times of my life. I have even had to have a cane in the past, and was 70 pounds heavier, would get out of breath easily, and had constant digestion problems, all from the steroids necessary to keep me alive. At one point, I nearly had a pacemaker. My dream now is that research will continue for adrenal insufficiency diseases, and that alternative and integrative treatments that are currently being researched and used in various parts of the world will be successful and accepted, while easily obtainable and affordable by all.
How adrenal insufficiency affects lives. Adrenal insufficiency affects many lives in many ways. Family, friends, co-workers, as well as the patient are affected. Adrenal insufficiency patients must take medication on a regular basis for the rest of their lives to replicate the cortisol and aldosterone that is not manufactured by the body. Patients are not only fatigued and find it difficult to function, but can suffer life-threatening consequences by trying to do many tasks that most people take for granted. Because of this, patients often miss events and important functions due to the lack of the missing hormones, while the next day they may be functional due to normal levels corrected by medications or the body's rhythm. Due to this, patients are often thought of as lazy, uncaring, or possibly suffering hypochondria by those who are not educated about the illness. Patients often suffer from anxiety and depression due to hormonal imbalances which can fluctuate, often from the body's cycles, missed or late medication, or not the right level of medication, because the body's needs change minute by minute. There is no resource to check cortisol levels outside of a lab on a daily basis, like with diabetes, for example. In addition, the immune system is greatly compromised, and patients need to be extremely careful to avoid sick persons. The fatigue, physical inability to function from low blood pressure or heart rate, anxiety, and avoidance of sick people often make it difficult or impossible to complete simple tasks like shopping, banking, working, etc., and the patient needs caregivers and others to help with simple tasks. Oftentimes, the patient is unable to perform these tasks due to fainting and injuries from falling. Often, hands do not function well, and patients have periods of not thinking clearly. During this time, safety is a factor when considering running errands, driving, or even working. Patients often need caregivers to assist in preparing food, remembering and administering medication, bathing, and other necessities if ill or recuperating from an adrenal crisis or even a stressful situation.
In March 2014, I was diagnosed with Addison's disease. I also have type 1 diabetes. I try my best every day with simple tasks, and when I feel my body becoming tired, I stop and rest until I feel better. What doesn't kill you makes you stronger. My daily meds are hydrocortisone 10 milligrams, fludrocortisone 100 milligrams, and omeprazole 20 milligrams. Some of my daily struggles are feeling tired and drained, overeating from steroids and never feeling full from meals, muscle weakness, mood swings, no motivation, low moods, waking up during the night and not being able to sleep, and numerous aches and pains.
Different types of medications for adrenal insufficiency. There are numerous commercial names and strengths for the medications used to treat adrenal insufficiency, but all fall under two categories: glucocorticoids and mineralocorticoids. Glucocorticoids are cortisol replacements, and the common forms are hydrocortisone, prednisone, and dexamethasone. These come in various strengths and administration forms around the world, which include oral administration, in addition to intramuscular or IM injection. Mineralocorticoids are replacements for aldosterone, and the most common form is fludrocortisone, which is manufactured under a couple of commercial names around the world. Adrenal insufficiency patients also take many vitamins and minerals, which is imperative because adrenal insufficiency causes deficiencies in some of these necessities. There are other treatments dependent upon the patient's condition. Those with Addison's disease are completely steroid-dependent and will face death without regular administration of their glucocorticoids. Many CAH patients produce cortisol, but in very low or cyclical amounts, and may only need their medication for stress dosing and in a crisis situation. Some of these patients use alternative medicines, such as homeopathic cortisol, for these needs, but should always have an emergency injection by prescription for an emergency. Patients with low aldosterone sometimes treat that particular insufficiency with regular and frequent supplementation of salt in the form of Himalayan and sea salts, salt tablets, or other forms of electrolytes, including marine plasma. It is important that these patients see a licensed physician, whether integrative, alternative, or allopathic, when treating with alternative methods. Not all patients are able to be treated in this manner. It is very important, if a patient's levels drop to a significant low, to see a physician for pharmaceutical replacement immediately, as self-medication and inadequate medication can cause death.
Since my diagnosis in August of 2014, just 6 months ago, I have been in the emergency room 7 times and kept for several days each time for low heart rates of around 74 to 37. Addison's has changed my life in a way I would never have believed. To even be able to get out of bed, I set an alarm at 7 a.m., take my medicine, 12 pills, then lay in bed for 30 minutes until the 7:30 alarm goes off so I can try to start my day. Each day is different, and I never know how much I can handle. My good times are mornings. I plan everything I can to be accomplished by noon because I may not be able to do anything after that. If I have an evening event, in order to go to it, I have to pretty much stay in bed most of the day to handle it if I even can. I think about things totally different and have to be careful around anyone sick because I cannot fight off even the simplest cold and it can hospitalize me. My recent crisis was 2 weeks ago when I caught a stomach flu that landed me in the hospital for 5 days. My Addison's has caused thyroid problems, other hormone problems, hypoglycemia, postural orthostatic tachycardia syndrome, chronic inflammatory demyelinating polyradical neuropathy, and my body cannot properly absorb salt, sugar, or control my heart rate without proper medicines. Sometimes even a simple shower is a task that can drain all my energy for that day. I never know how much I can do because even the weather and the temperature affects energy. I would give anything to be normal again. My body slowly loses organ function from the Addison's itself, not to mention the side effects from medicine, which ranges from nausea every day to constipation one day and diarrhea the next. Addison's is a constant daily guessing game of how much I can accomplish. Unless you have adrenal insufficiency, you can never really grasp how it cripples your life.
What is stress dosing? At certain times, people with adrenal insufficiency need to take extra steroids due to additional strain and stress on their body. This can be due to physiological or emotional stressors. For example, they need to increase the dosage of steroid if they experience any of the following: an illness or infection, particularly if they have a high temperature of 37.5 degrees Celsius, 99.5 degrees Fahrenheit, an accident or serious injury, the need to have an operation, dental or medical procedure, e.g. tooth filling, endoscopy, etc., taking part in strenuous exercise or physical labor which is not usually part of the daily routine, diarrhea lasting more than 24 hours or more than 3 times consecutively. An additional hydrocortisone dose may also be required in situations of severe and prolonged psychological stress, such as death of a relative, traumatic news, good events that are stressful, such as weddings, dinner parties, etc., acute depression. Once the stress situation is passed, the patient must reduce or wean back to standard dose very gradually to avoid a sudden drop in cortisol, which could cause an adrenal crisis. What is an adrenal crisis? An adrenal crisis is when the demands of cortisol are not met by the body. A patient may experience stomach pain, low blood pressure, vomiting, shaking, extreme cold, paleness, and fainting. If no intervention is administered through extra medication, often called stress dosing, or with an emergency injection of Solu-Cortef intramuscularly, the patient can go into a coma due to shock and die quite quickly. Solu-Cortef is a steroid and is administered in a much higher dosage than the oral medication. Patients who have forms of adrenal insufficiency which affect their salt retention and water balance benefit from fast administration of sodium during these times as well. If a patient enters a crisis and does not see improvement through any of these methods, they can quickly go into a coma due to shock. If no professional medical intervention is then received, the patient can quickly die. This includes IV fluids, more Cortef, and other medications dependent upon the patient's vital signs and current status when receiving care, which must be immediate. Although patients may regain consciousness from an adrenal crisis, oftentimes they are never able to function the same again and can lose physical or cognitive functioning in varying degrees. An impending adrenal crisis is often detected by dehydration and low blood pressure, but at other times, symptoms are sudden, and a crisis can occur without warning. If you feel a patient with adrenal insufficiency is beginning to go into crisis, it is important to inject Solu-Cortef before calling EMTs or taking the patient to the emergency room. A matter of minutes could mean life or death for the patient. When talking to emergency medical personnel, it is important to tell them that the patient is steroid dependent and is having an adrenal crisis. If you or anyone else have injected them with Solu-Cortef, please advise them of this. Surprisingly, many states do not have newborn screening for CAH, while some require it for every infant. Many states do not mandate their ambulances and paramedics to carry Solu-Cortef or other cortisol injections, nor do they have other protocols for adrenal crisis for those with Addison's disease, CAH, or other adrenal insufficiency illnesses. Surprisingly, many emergency rooms do not have staff trained in recognizing an adrenal crisis or even have a protocol for immediate treatment. These reasons are why this awareness video is important. You can help by knowing how to recognize the signs of an adrenal crisis. And should you know someone with an adrenal insufficiency disease, you can learn how to administer medication and what to tell emergency personnel. Please share this video with your local emergency responders, hospitals, and physicians, as well as social media and others. Appropriate medical treatment can help light the life fire.